Amid a new surge in COVID-19 cases, an updated vaccine has arrived. But for many of the people who need it most, getting the shot has become a maze of red tape and surprise bills. The Food and Drug Administration has authorized the vaccine for two groups: anyone 65 and older, and people of any age with certain medical conditions. That narrower guidance departs from previous years, when virtually every adult was encouraged to roll up a sleeve. On the ground, the shift is sowing confusion. California resident Allison Engel, 74, was told at her CVS that Medicare hadn't loaded the new shot. Rather than wait, she paid $225 out of pocket. In Texas, 78-year-old Brant Mittler and his wife encountered the same roadblock. And in New York City, 67-year-old Matthew D'Amico and his 75-year-old wife were refused at Walgreens because they lacked a prescription, something they'd never needed before. Three things are gumming up the works. First, a lag in Medicare's billing system. Some pharmacy computers still reject the claim, even though Medicare is supposed to cover the shot. CVS says many insurers are still updating. Medicare officials say they're investigating, but in the meantime, elderly patients are being asked to pay or walk away. Second, a timing gap at the CDC. Most states let pharmacists vaccinate without a doctor's prescription only after the CDC's Advisory Committee on Immunization Practices, known as ACIP, signs off. That committee won't meet on the new shot until September 18th to 19th. Until then, pharmacies are improvising. Which leads to the third problem: a patchwork of pharmacy rules. CVS now requires prescriptions in 13 states and Washington, D.C. In Massachusetts, Nevada, and New Mexico, the chain briefly paused COVID vaccinations altogether, though Nevada has since restarted. Walgreens has its own state-by-state mix of prescription requirements while it waits for ACIP. The policy is rolling out under the new Health and Human Services Secretary, Robert F. Kennedy, Jr., who has assured the public that most Americans will be able to get it from their pharmacy for free. Senators from both parties say that promise rings hollow while seniors are being turned away at the counter. Although older adults dominate the headlines, the high-risk category for people under 65 is surprisingly broad. Being overweight, smoking, having a mood disorder, or even being physically inactive can qualify you. A 5'4" woman who weighs 145 pounds meets the overweight threshold and is technically eligible. Yet many potential recipients have no idea. Public health experts worry the snarls will discourage vaccination just as the so-called Stratus variant gains ground. Every unnecessary hurdle increases the odds of severe illness and fuels skepticism about who can and should get the shot. So what can you do right now? If you're on Medicare and get turned away, ask a pharmacist to rerun the claim or try a different location. Some systems update faster than others. If you're under 65, review the CDC's list of qualifying conditions. You may already be eligible. Call ahead. Policies vary not just by state, but by store. All eyes now shift to the ACIP meeting on September 18th to 19th. Its recommendation will likely decide whether this season's vaccine rollout goes smoothly or remains mired in chaos. For the moment, access depends on where you live, what insurance card you carry, and which pharmacy happens to be on duty when you walk in. The vaccine may be approved, but for many Americans, it's still out of reach.